Welcome back, everyone. I'm Steve,
And I'm Scott.
and together we're Backyard Musings, broadcast in Apple Valley, California.
Science and Technology Channel.
Somehow our pictures now are reversed. You're on that side, and I'm on this side. Normally, I'm on that side, and you're on this side. I don't know what I
Really?
did. Yeah, I don't know. It's because I put the name Scott and Steve because you're normally on that side. So I don't know what I did. I don't know what I touched, what button, but it's I'm on the correct side now.
Well,
Usually I'm not.
You are Steve.
I am. Mustache and
Scott.
Steve, yeah. You can call me Mustache. I'll respond to that too. All right. A pioneering sound wave therapy that targets the brain's emotional control center has shown powerful results in reducing symptoms of depression, anxiety, and PTSD. That's awesome. All without surgery or medication. In a recent clinical trial at UT Austin, thank you, Texas, patients underwent daily non-invasive ultrasound treatments for 3 weeks and experienced significant mental health improvements, signaling a bold new frontier for psychiatric care. The scientists' research was published in Molecular Psychiatry on April 24th, 2025. Would you like to know more?
This is pretty interesting.
It is. I mean, it's a new treatment.
Yeah.
Love it.
Yeah, this is really good. And it sounds to be like it's not very aggressive. It's just thorough, right?
Oh, yeah.
So, okay, people living with depression, anxiety, and trauma-related disorders found significant relief after receiving a new non-invasive brain treatment that uses sound waves to gently stimulate deep areas of the brain. The research conducted by Dell Medical School at the University of Texas, Austin, highlights a promising alternative to traditional psychiatric interventions.
The study shows that low-intensity focused ultrasound can safely and precisely target the amygdala, a brain structure often overactive in mood and anxiety disorders, without the need for surgery or medication.
This is a quote. Participants showed marked improvements across a range of symptoms after just 3 weeks of daily treatment, said Gregory Fonzo, PhD, senior author of that's Fonzie. Senior author of the study and assistant professor in the Department of Psychiatry and Behavioral Sciences at Dell Med.
Let me see that smile. Come on.
Going on with a quote, what makes this approach revolutionary is that it's the first time we've been able to directly modulate deep brain activity without, I wonder if they tried this on Maxine Waters. No, maybe not. Without evasive procedures or medications. I
don't think she's beyond any kind of help.
No redemption. She can be treated?
No, or redemption, yeah.
No. You know, we're all God's children.
No. So. In the double-blind trial, 29, I'd feel better if that was 3,000 or 2,900, 29 individuals with mood and anxiety disorders underwent MRI-guided ultrasound treatments directed at the left amygdala. The therapy led to immediate reductions in amygdala activity. After 3 weeks of treatment, patients reported clinically meaningful improvements in depression, anxiety, PTSD symptoms, and overall emotional distress.
Okay, another quote. For decades, the amygdala has been a target of interest, but access has required either brain surgery or indirect approaches through cortical stimulation, says Fonzo.
Yay.
Going on with the quote, this technology opens a new frontier in psychiatric treatment, potentially offering relief to patients who haven't responded to traditional therapies.
The treatment was well tolerated with no serious adverse events, suggesting a promising safety profile as researchers move toward larger clinical trials. I guess they had to be, you got to be careful where you're aiming, looking for the amygdala, you got to hit that.
If targeted sound waves help, then sound vibrations from listening to loud music may also help. Maybe this is one reason why there are people who feel they benefit from going to loud concerts and dances. However, it's important to draw a clear line between clinical neuromodulation, and subjective mood enhancement. The focused ultrasound used in this study is not the same as sound vibrations from your average bass-heavy concert. We're talking about millimeter precise, MRI-guided acoustic energy capable of modulating neuronal firing deep within the brain, specifically the amygdala. Concert speakers, on the other hand, are more likely to modulate your eardrums and balance.
You remember the Cuban syndrome, where people at our embassy in Cuba were getting like headaches and nausea, and they think it was from directed, sound waves. Remember that?
What, the sound waves coming from?
Covert agents, Russians, communists attacking our
Embassy
personnel. Yeah,
Wow.
with focused. You didn't.
I don't remember that. Yeah.
Huh. I wonder if that.
I could have been on one of those loud.
It's like microwave.
I could have been on one of those loud concerts that you're talking about. So
No. I'm talking about because state officials don't go to loud concerts.
no, I could have been there. That's
you could have been there.
Maybe
Okay.
that's why I didn't.
Okay.
I didn't.
You didn't register?
Remember.
Yeah. Okay.
Yeah.
Deep brain activity is also affected by psychotherapy and eliciting emotions indirectly. What is revolutionary here is the direct, non-invasive targeting of a subcortical structure, bypassing the slower and more diffuse pathways of talk therapy or medication. No metaphors, no motivational posters, just physics.
We like physics.
Yes, it's science. Weird science.
Yeah. So like I was saying earlier, this sounds like it's pretty aggressive. It's just pinpointing the area, which we like that. Yeah. So we've talked about other stuff that does that, right? Where it's not.
Yeah, an MRI could, know exactly where that amygdala is. And
right.
then you just go for it.
But we talked about other pinpoint type of treatments, like when we've talked about radiation and chemo, where they just go in and attack a whole area. Where now they're starting to get a little bit more precise on it. So like this is good stuff.
Yeah, this is really good stuff.
Good information. So.
And it's like sound. You don't have to cut anything or go into no experimental brain surgery.
I wonder if it would help with Trump derangement syndrome. You think? Maybe.
I don't know. Let's get some deranged people in there.
Yeah, let's get some feedback.
Give us some deranged people in there, and we can try it. Yeah,
experience for that. So anyway, great topic. Thank you.
Thank
for
you.
listening.
Thank you, producers, and everyone. Click the like button.
Yeah. Take care, everyone. Thank you.